Alright, so this is for Case B Part 2 for Module 4 Application Abilities. So what manual technique would be appropriate for this patient, and what's your rationale for each? So at week 2, I would do an ice cup massage. We could take our little ice cup and you could apply it to the elbow. And while applying it to the elbow, you could basically be performing a little bit of a massage superficially to the tissue. And what you could do is you would use this for pain and inflammation control for this patient. Essentially, you're trying to move some inflammation back proximally towards the heart, and again, break up any small adhesions. For week 8, we could do some traction and mobilization from extension with a medial glide in extension and pronation, as well as a lateral glide for pain control and to maintain full range of motion. You would want to do these for 4 to 5 sets of 30 to 45 seconds each set. We could then do some PNF patterns, contract, relax, and rhythmic stabilizations. Again, 4 to 5 sets, 30 to 60 seconds. So for that traction with mobilization from extension, again, we're going to want to provide some traction coming down, stabilizing at the humerus, and then provide a medial glide. And then you could also provide a lateral glide. So pull out and then provide a lateral glide. For contract, relax at the wrist, so they could go into flexion, contract, and then take them into extension, relax, increasing wrist range of motion. They could then come into wrist extension and then relax, taking them further into wrist flexion. You could also do the same at the elbow, so flex, you're contracting, relaxing, taking them further into extension. For your PNF pattern, you then could have them down here. They are internally rotated, and as they come up, you provide resistance, going into external rotation, coming back down with resistance. Then for the next question, what exercises would you prescribe and when and why? So at week 2, you could use a TheraBand with wrist flexion and extension. We don't have a TheraBand, but essentially you put the TheraBand in the hand and they could do flexion. You could turn it around when they're pronated and do extension. That'd be for strengthening. We then could give our patient a ball and they could squeeze. It could be putty. Essentially that's for strengthening as well for the fingers, hand, and wrist. Again, we could do the contractor and relax. At this point, I'd do 10 sets of 30 seconds, just maintaining range of motion and strengthening. And then we could just also do some stretching of flexion, extension, and pronation, and supination of the elbow, just regaining and maintaining full range of motion, as we described in the first question. At week 8, we then could do eccentric elbow flexion and extension. So I would instruct my patient to come up into flexion and then slowly let me pull down, still maintaining resistance. That'd be the eccentric for elbow flexion. You could do 3 sets of 10 for that for strengthening. Again, we could go back to that PNF pattern of D1 and D2. That's for strengthening and functional pattern of movement. And then flexion extension for wrist and elbow dumbbell exercises. So if we had a dumbbell, we have a mushed up pumpkin, but we put this in our patient's hand, start with a weight that they can do. I would start out with probably 1 pound, go into wrist flexion, 3 sets of 10. They could do the eccentric motion or concentric motion. There's concentric, he was just showing eccentric. If you go into extension, they could do the concentric and then eccentric motion. And then as well, we could maintain stretching of flexion, extension, pronation, supination at the elbow for range of motion.